Today, we're talking about cancer, not the most fun topic. Everyone here has been affected by cancer, either personally or someone that they know or love. And it's scary. I have so many patients who are worried about getting cancer, or I have some patients who have had cancer and want to do everything in their power to make sure that it doesn't come back. And then others are worried because maybe they have the gene for certain cancers. So, no matter why you're worried about cancer, this talk is for you. And today's talk is really about understanding that there are certain lifestyle changes that can be made to lower your risk of getting cancer. And if you've already have had cancer, there are some changes that you can help to minimize the risk of the cancer coming back. I'll show you the things that you can do today, right away, to start lowering the risk of getting cancer. Now, notice that I said minimize the risk, lower the risk. I didn't say I have the cure for cancer or that I can guarantee prevention. The name of the game is minimizing risk. That's why we wear a seatbelt, right? It minimizes the risk of dying in a car accident, but it doesn't prevent all deaths or fix the crashes once they've happened. Here's another example that we kind of all know when it comes to lowering risk is that we all know that smoking increases your risk of lung cancer. So, never smoking doesn't mean you will 100% prevent lung cancer, but it certainly reduces your risk. So, everything we talk about today is about risk reduction. It's about reducing the risk of disease. That's what we talk about kind of every week is what do I need to do to risk the cause of a certain disease, right? Whether it's autoimmune or Alzheimer's, we talk about this week after week after week. And the same is true here. What we're covering today is how to reduce the risk of cancer and increase the possibility that we will lead long, healthy lives. So today I'm going to show you the things that you can do to help minimize the risk of getting cancer. So before we dig in, I always like to let you guys know how to reach me and my team. We're called the new method because you always knew there's a better way. And we're on every platform: Instagram, YouTube, TikTok, Threads, Facebook, of course, a website. So wherever you are, if you send us a message, someone will get back to you. And if you are watching us on YouTube, don't forget to like and subscribe. If you're listening on the podcast, I'm wearing a white sweatshirt today and my hair looks great. So let's dig in now that we have all that covered. Cancer is the second most common cause of death throughout the world. Cardiovascular is the first. And while there's been amazing medical advances in recent years, no question, we're still likely to see some 20 million new cases by 2025. So we're advancing, but we're also seeing more cases. But what is cancer? Cancer is a term that refers to a group of diseases that are characterized by uncontrolled growth and division of cells, right? So we have cells that are constantly dying and turning over in our body. That's normal. But when we have an uncontrolled growth, uncontrolled cell division, that's cancer. And then these cells can invade and destroy nearby tissues, and they can also spread to other parts of the body. That's something called metastasis. So, as I said, normal cells in the body grow, divide, and die in a controlled and orderly fashion as part of the body's natural process. But in cancer, this normal process goes haywire. Sometimes it's genetic mutations, but sometimes there's other factors that come in that disrupt this controlled cell growth and division, which leads to cancer. And that's kind of what we're going to focus on is those factors. Now, one of the major advances that we've seen over the last few decades is that we now understand that there are changes that we can make to our lifestyle right now to minimize that risk, those factors that disrupt that cell growth and division. We want to hone in on that and see what we could do to change that because we've come to understand that certain things we do in life increase the chance that this process will go haywire, and certain things we could do to help reduce the chance of this going haywire, right? So let's go for an obvious one, kind of right off the bat so you know what I'm talking about. Smoking. We know that smoking increases your risk of lung cancer. Like, duh, who doesn't know that, right? But believe it or not, there was a time we did not know this. It was only in the 1950s that there were actually studies done to show the link between smoking and lung cancer. And now we know that 85% of lung cancers are caused by smoking. And we also know that if someone quits smoking, after 10 years, the risk of getting lung cancer goes down by half compared to people who are still smokers. So we know all this. And over the years, we're discovering that there are more and more things just like that wasn't obvious before the 50s and which is now super obvious. we're discovering that there's more things we can add to that list that if we're exposed to, they're going to increase our risk of cancer. And on the positive side, there are more and more things that we can do to help lower our risk of cancer. And this is important because the goal of this is always to empower us, empower you, my game changers, to make changes to improve your ability to stay healthy. And that's what we do in functional medicine. We're constantly looking at the root cause for any disease, including cancer. Because if we can find the root cause, and then maybe we can start thinking of ways to reduce the risk. Now, if you're already dealing with cancer, of course, you should be using all the treatments of conventional medicine. Okay, this is not an either or conversation. Do every single thing the oncologist is recommending, but what I'm proposing is that you consider adding a functional medicine approach to create an integrative approach. Right? By all means, take the medications, do the treatments, but also implement the things that I'm going to be talking about today to increase your odds of beating your current battle and help reduce the chances of recurrence. I just had this conversation with my patient yesterday who was diagnosed. Of course, we're going to hold her hand and make sure she goes through all the treatments. We're thinking of you if you're listening today. But we're also going to start implementing lifestyle changes to make sure she gets through this battle. Okay, so if you're dealing with it, this is still for you. Conventional medicine has made huge strides in how it treats cancer, right? So please be sure to do what your oncologist recommends. But for some reason, conventional medicine doesn't seem to recognize how much of an impact your life choices can make on the treatment and the prevention from recurrence. I can't tell you how many of my patients who are actively getting treatment for cancer are advised by their docs that it doesn't matter what they eat or what vitamins they take. It doesn't make a difference. It doesn't make any sense. Because at the same time that people are saying that, the American Cancer Center recognizes that there's a significant proportion of cancers that are caused by modifiable lifestyle factors. Let me just give you a quick list of what the American Cancer Society has agreed, obviously, that are connected to risk of cancer. Okay, and from that we're going to extrapolate everything else. So we already discussed smoking. Smoking introduces carcinogens into the body, which changes our chemicals, damage DNA. Diet. This is from the American Cancer Society. Diets high in processed foods, sugar, unhealthy fats leads to chronic inflammation and oxidative stress. And guess what chronic inflammation and oxidative stress does? Damages DNA, promotes the growth of cancer cells. Physical inactivity. Lack of physical activity can lead to obesity and insulin resistance. We know this, but did you know that this insulin resistance elevates insulin and something called insulin-like growth factor, IGF levels, which is associated with increased risk of breast and colon cancer. Alcohol. Alcohol is metabolized in the body. We drink it, we're feeling kind of happy, but that gets metabolized. And when it gets metabolized, it goes into something called acetaldehyde, which is a carcinogen. The acetaldehyde can damage DNA and impair the body's ability to repair, increasing the risk of mouth cancer, throat cancer, esophageal cancer, liver, and breast. UV radiation exposure. UV radiation damages the DNA in skin cells, leads to mutations in skin cancer. It also promotes free radicals, which further damages DNA. And of course, there's infections, viral infections like HPV can disrupt the DNA. Chronic hepatitis B and C. Here's one that you might not have considered: obesity. The adipose tissue, the fat tissue, adipose is a fancy word for fat, produces inflammatory molecules. And it also produces hormones such as leptin and adiponectin. And all this creates this chronic inflammation, chronic hormonal imbalance, which can lead to development of cancer. And of course, we have environmental toxins. There's some obvious ones: asbestos, radon exposure, etc. So we know that smoking, alcohol, UV rays, toxins, chronic infections, diet, exercise, obesity can affect your risk of getting cancer. Now, if you watch any of my episodes, this is pretty much all we talk about every time. We talk about nutrition, we talk about sleep, we talk about stress, we talk about movement as it relates to the gut, skin connection, the gut-brain connection, your gut hormone connection. We discuss this week after week after week over years on this podcast. We discuss how what we put into our body can cause these diseases. Hey, I'm dealing with psoriasis. Hey, I'm dealing with brain fog. Hey, I'm dealing with an autoimmune issue. Why would we think anything else when it comes to cancer? Who in their right mind can conclude, oh, yeah, sugar every day? Of course, that's going to cause diabetes. But no, it has no effect on cancer risk. Oh, obesity? Sure. That's a lot on the heart. Maybe it's going to cause blood pressure. But cancer risk? Nah. Movement? Sure. That's important for your lungs, for your cardiovascular. But nope, no connection to cancer, right? It doesn't make sense. Of course, it doesn't make sense. And like I said earlier, so many patients come in working with top notch oncologists and other amazing specialists who tell them it doesn't matter what you eat. You want to eat a donut, eat a donut. It won't matter. But it does matter. And they keep telling them, eat the standard American diet. None of it matters. But how does that make sense? So I think you're beginning to understand, right? Stress, movement, nutrition, supplements, everything we talk about here week after week will affect your risk of getting cancer, beating cancer, making sure it doesn't recur. Okay. So let's break it down a little bit. Stress. I want to start with stress this time. I often start with nutrition because so many of my patients save this part for last, right? They'll do the elimination diet, they'll take the supplements, they'll do the intermittent fasting, but they won't get out of the stressful job or the very bad relationship. They will stay in rough situations thinking that's not affecting their health. This will not work. Stress is linked to so many diseases, including cancer. Now, we're not talking about stress before an exam or a speech, right? We're talking about this chronic, no end in sight stress. This can weaken your immune system, leaving you open to diseases like cancer. So it's critical that your stress is addressed. And if your stress is not something that you can leave, right, taking care of a family member, then it's critical that you learn how to manage its effect. You're right, it might not be realistic to leave a stressful situation. You know, we're taking care of our kids, we're taking care of our parents, we're the sandwich generation, or many of us. But if we can't leave the stress, we have to learn how to manage it so it doesn't manage us. So if that means meditation, breathing, taking a walk, whatever it looks like for you, but really accepting that stress can make you sick, not on a theoretical level, like truly, truly, truly on a molecular level. Okay. Research shows now that chronic stress actually can make cancer spread faster, especially in ovarian, breast, and colorectal cancer. When the body becomes stressed, neurotransmitters like norepinephrine are released, which stimulate cancer cells. Chronic stress also means if you're constantly on the go, freaking out, everything's a mess, it also means you're less likely to make the changes necessary to lead a healthy lifestyle, to take a moment for yourself. If you're busy running around taking care of everyone else, are you going to meal prep? Probably not. Are you going to remember to take your supplements? Probably not. Are you going to make time to move? Probably not. So stress ups your risk for everything because you can't take care of yourself, right? It ups your risk now for digestive problems, ups your risk for depression. All of these things cause inflammation and again creates an environment for cancer to grow. So fix your stress first or along with the rest of the advice that I'm going to give you. Don't leave it to the end. It's not optional. You have to take care of it. You really do. Now, before I get to what to eat, what not to eat, what supplements to take, let's also talk about movement because, again, this is something that many of my game changers leave last on the list. And notice I said movement. I'm really careful not to say exercise because everybody's movement is different. Movement can lower cancer risk, first of all, because it helps control weight, right? So we know we've already discussed the connection to obesity. It can reduce certain hormones, reduce insulin, strengthen the immune system. There's a study done by the American Cancer Society found that leisure time physical activity was associated with a significantly decreased risk of breast cancer, colon cancer, esophageal cancer, liver cancer, stomach cancer, kidney cancer, myeloid leukemia, right? Right there, just with increased leisure time physical activity. I'm not talking about joining the craziest gym and going to the max, just increase in activity. In addition, physical activity was associated with a decreased risk of multiple myeloma, blood cancers, and cancers of the head and neck, rectum, bladder, and lungs. So this is just what the research shows, okay? So of course it is decreasing our risk. And it also boosts quality of life if you're undergoing cancer treatment because you'll have improved energy. Also, exercise and movement helps repair your mitochondria, which is super important. exercise and movement reduces your risk of recurrence of cancer. So we're talking about, in some studies, reducing the risk of recurrence by 50% just by adding some movement. How much movement is debatable. I know a lot of the research talks about 30 minutes of a brisk walk 5 days a week. That's great for some people. For some people, that's a little too easy, 30 minutes of a brisk walk. And so I say, don't downgrade yourself, go to where you're comfortable. But for some people, that's really, really hard. They can't walk 30 minutes every day because of other issues going on. So that's okay. Go to where your comfort zone is, go to where it doesn't deplete you. And then every day you try a little bit more. Whatever that looks like is 100% accurate. And no matter what you're doing, it's better than not doing anything at all. Don't forget that, okay? So we talk stress, we talk movement. Let's talk a little bit about toxic burden. Okay, toxic burden is all the things that you're putting in your system, the poor diet, the lifestyle choices. These are major factors in the development of cancer, but they're not the only ones. We're also talking about everything we're exposed to in the modern world. So, the scents and the perfumes and the chemicals in the air, what we drink, what food we consume. Now, here's the thing. Our body constantly detoxes all day. It does it automatically. You don't need a special detox protocol. You don't need, a 30 to 60 to 90-day detox thing. Your bodies are constantly all day long taking in toxins. You're touching it, you're breathing it, you're drinking it. You're constantly taking in toxins, and it's constantly detoxing. It's a process called biotransformation, phase 1 and phase 2. And it just does it all day long. That's how it manages drugs, alcohol, medications, but also carcinogens, free radicals. It's just constantly accepting and cleaning up, accepting and cleaning up. And it does it all day long in the background without you even knowing. But our system has limitations. It can only handle so much. So much, too much of it is just too much. So part of the conversation is limiting your exposure to a chemical. Right? Maybe, being around a scent once in a while is fine, but maybe being every single day exposed to, high levels of perfumes would be too much. So some limited exposure to a chemical or a drug is fine, but longer exposure will be too much to handle. Now, this system, so we're talking about less exposure, that would be ideal, but also recognizing that this system is constantly working and that we need to support it. We need to help it along. So guess what helps supports this constant natural detox pathway? What you eat, how you move, hydration, reducing alcohol, reducing your caffeine, making sure you sleep, reducing your stress, and of course, there's some supplements that we'll talk about. But what the point is that everything we've been talking about, the diet, the movement, all that, is also, it's not just, how else is it reducing like your risk? Because it's also helping your natural detox pathway work, right? So if you have a factory and its job is to constantly take the toxins from the world and repackage them and take them out into your bowels or your urine, if you have this factory and you don't attend to the factory, you don't make sure that it has all the tools and that it's, functioning properly, and you just ignore it, how well do you think it's going to work? It's not going to work well, right? So we have to talk about giving the support necessary for this natural detox pathway to work so that as we're assaulted with these constant carcinogens, our body can clear them. So everything we talk about helps that as well. Now we could talk a little bit about nutrition, because by now that there's no more powerful medicine than what's on your plate. I did a whole episode on, food is either medicine or poison and nothing in between. You can check that out. And what you need to think of is, what is your plate full of? Is your plate full of chemicals that adds to your toxic burden, forcing your detox pathways to work harder? Or is your plate full of nutrients and vitamins and minerals that will help your body detox and recover and repair? Every plate is a choice. And if you're worried about cancer or are already battling cancer, why would you give your body more to deal with? Why would you ask your body to manage processed foods loaded with chemicals that the body doesn't need? Remember that factory I told you that's constantly working? Why would you overtax it? Why would you add sugar and inflammatory foods that your body needs to contend with? It's already doing so much. Why add to it? Instead, you want to focus on getting the rainbow on your plate because those colors in your food, they're actually phytonutrients. They're chemicals that your body needs in order to help function. And we also need protein to help us heal and good fats to help us repair. So what decision are you making on your plate? A decision that makes it harder to overcome cancer or a decision that makes it easier to either overcome or prevent? Now, a quick word about sugar. When there's a term there that says sugar feeds cancer, I want you to know that this is not a metaphor. We're being quite literal. There are actually several ways that sugar can do that. We'll just go over a few. It causes inflammation. Inflammation is a breeding ground for diseases like cancer. It raises insulin, and we talked about insulin like growth factor, which has been connected to cancer. And cancer requires a lot of energy. Remember, all these cells dividing, they require a lot of energy. So, what do you think happens when you feed a lot of high glucose consumption? It gives it the gas it needs to grow. There are so many more connections between sugar and cancer. But the bottom line is anyone says it doesn't matter what you eat, go ahead and have your donuts, has it wrong on a biochemical level. Okay, this is not like philosophical. On a biochemical level, it is affecting you. Let's talk a little bit about obesity also. The American Society of Clinical Oncology estimates that obesity is going to overtake smoking as the number one cause of cancer worldwide. Okay? Overtake smoking. So it's going to be more dangerous than smoking in terms of cancer. Why? It creates a hormonal imbalance. Obesity often comes with a higher level of estrogen, making it higher risk for breast, endometrial, and other cancers. Obesity is this constant chronic inflammation. This inflammation causes DNA damage over time. We discussed that obesity results in insulin resistance, insulin-like growth factor. The fat tissue, the adipose tissue, promotes unwanted cell growth and contributes to cancer development. Obesity causes oxidative stress, which means there are more free radicals that can create more damage. So again, managing your stress, changing your nutrition, adding movement to your life, they're all going to affect you biochemically and helping reduce your risk of cancer, battling cancer if you have it, and preventing recurrence. Okay? Now, a quick little life hack when it comes to decreasing risk. We've talked about the general things, but one thing you can add right away is intermittent fasting. And I have a whole video out there how to do intermittent fasting and what it does and why it helps. But I want you to know that intermittent fasting is a huge player when it comes to cancer. We know that fasting lowers inflammation, it lowers oxidative stress, right? Which are the things that we know that are part of the cancer picture. And it's one of the main things that has been shown to help improve longevity when we cut back on the hours that we eat. Okay, so something to consider, just something quick that you can implement right away. What we found is that when you are fasting, you're burning your fat, which basically, in a quick sense, kind of starves off some cancer cells, shrinks cancer cells. There's a lot of studies between intermittent fasting and cancer. So whenever possible, add intermittent fasting into your life. It's amazing for your immune system in general, and is just going to help you get to where you're going. Now, of course, no talk will be complete without supplements because I know you guys always want to know about supplements. And I'm going to say this. I know you know this because you're my game changers. You know this, but I have to say it anyway for anyone new here. There is no supplement in the world that will cure your cancer or guarantee that you'll never get cancer. So if anyone says that, please, please, please run away. But there are supplements that act as antioxidants and anti-inflammatories, which we know are key players in cancer. So that's the focus. So we have vitamin C, super antioxidant, protects cells from free radical damage, supports immune function. CoQ10. Oh my God, CoQ10. The more I learn about CoQ10, the more I want to take a shower in it. Okay. It is amazing. When I first started out 10 years ago, I thought CoQ10 was just a cholesterol conversation. Absolutely not. It's everywhere. It's in mitochondria. It's antioxidant like CoQ10, just CoQ10. Okay. Omega-3 fatty acids reduce inflammation, which is associated, again, with increased risk of cancer. Glutathione. Super antioxidant. Remember I told you about that factory, that constant detox factory. One of the things that you can do to help that factory is to take glutathione. It's a huge part of that natural detox process that happens in your body. Zinc. Zinc is essential for immune function, essential for your thyroid, helps maintain DNA integrity. Selenium, same thing. And then vitamin D. You just cannot walk around with low vitamin D and just be like, yeah, I've always been low. Yeah, of course you're low, sis, because you're not taking it. You have to take it. Oh, I took it and the vitamin D got better. And then I stopped taking it and it went down. What do you think is going to happen? What did you think was going to happen? You have to keep taking the vitamin D forever. Okay? You have to keep taking it. You need it. So here's the bottom line. Sorry, I went on a vitamin D rant. I'm not sure why I got so emotional, but such an easy thing to fix. Just take the vitamin D. So here's the bottom line. We know that a huge number of cancers are influenced or caused by our environment. And our environment means what we eat, what we drink, how our modifiable lifestyle factors. That's what I mean by environment. But this means there is so much in our hands that we can do to decrease our risk of getting cancer, helping us if we're battling it, and decreasing our recurrence. And again, I'm saying decreasing. Of course, there's no 100% guarantees in this, but decreasing risk is really what it's about. Reduce your stress. Get moving, whatever movement looks like for you. Pay attention to toxins in the environment. Change your nutrition. That doesn't mean you have to go on a crazy diet. Change your nutrition. Add the right supplements. Take control of your health and make your body an unwelcome place for cancer. As always, if you want to work with me and my team, we are called the New Method because you guys always know. You knew there's a better way. You could reach us at the New Method everywhere, newmethod.com, everywhere. But remember, you are a game changer because you always knew there was a better way. I'll see you guys next week.